You know, when you think about the concept of medical transportation, your mind probably jumps immediately to the vehicle itself.
Oh, absolutely. Yeah, it's a very visual thing.
Right. I mean, you picture a white van pulling up to a curb. Or you visualize, like, a driver in a uniform operating one of those hydraulic lifts.
Yeah, or helping a passenger into the back seat.
Exactly. We naturally focus on that physical journey from the house to the clinic because, well, it's the tangible, visible manifestation of the service. You see it on the street, and your brain just says, oh, okay, that's what medical transport is.
It makes complete sense that we default to that image, honestly. It's the public-facing side of the entire industry. I mean, the van is what actually occupies physical space in our neighborhoods.
Yeah, you see them all the time.
Right. But if you actually look at the mechanics of how that ride happens, the vehicle itself is really just the final concluding act of a massive, highly orchestrated process.
And that is exactly where we are going today. We are completely flipping the script on how you, as a listener, probably view this industry. Because a safe, reliable medical ride begins long before an engine ever turns on.
It really does. It starts with an entire hidden ecosystem.
Right. So today, we are exploring the invisible architects of that journey. We're talking about the dispatchers, the schedulers, and the customer service teams that operate completely behind the scenes in non-emergency medical transportation, or NEMT.
And that's our core mission for this deep dive. We are going to unpack the essential communication tasks of NEMT dispatchers. We want to understand, the exact mechanisms of how their interactions build patient trust right out of the gate.
Which is so crucial.
Exactly. We'll explore how they meticulously verify a person's physical mobility to ensure safety. And we'll break down the really high-stakes duties of scheduling and customer service in a field where, honestly, a simple typo can literally disrupt someone's medical treatment.
It's wild to think about. I was looking through the framework provided by SwiftAid Transport. They specialize in NEMT. And what hit me immediately is that we have to divorce this entirely from the idea of, like, booking a taxi or an Uber.
Oh, completely. It's night and day.
Right. This isn't just about moving a person from point A to point B. This is fundamentally about protecting and facilitating access to healthcare itself.
If you take away anything from our conversation today, it should be that exact point. Transportation is a social determinant of health.
A social determinant of health.
Yeah, exactly. To really understand the dispatcher's job, we have to start at the very first touch point between a passenger and the provider. That first contact.
Like the very first phone call.
Right. It might be a phone call, it could be an email, or maybe a secure online form, but that single initial interaction establishes the entire trajectory of the ride.
That makes a lot of sense. If you think about the psychology of the person making that phone call, it's rarely a relaxed situation.
Not at all.
I mean, if I'm calling a regular cab, I'm probably going to the airport or, like, a restaurant. I'm generally fine.
You're in a good mood, probably.
Right. But in NEMT, the environment surrounding that phone call is almost always fueled by illness, by stress, or, caregiver fatigue.
Exactly. I mean, consider who is actually on the other end of that phone line.
Yeah, who are they?
Well, it might be an elderly patient who just received a really frightening diagnosis, right? And they're trying to figure out how to get to an oncologist all the way across town.
That's terrifying on its own.
It is. Or it could be an adult child, part of that sandwich generation who is sitting in the parking lot at their own job on their lunch break.
Oh, wow. Yeah, just frantically trying to arrange transportation so their parent can get to dialysis.
Exactly. Or, and this happens a lot, it might be a discharge planner at a major hospital who has 3 patients ready to go home, beds that desperately need to be cleared for the emergency room, and they are trying to coordinate safe exits for all of them simultaneously.
That sounds chaotic. The best analogy I could come up with while reading through this material is that the NEMT dispatcher acts essentially as a logistics triage nurse.
I love that comparison. That's highly accurate.
Because they aren't just taking an order like a waiter writing down a menu item. They're actively assessing a highly complex, often really messy human situation.
Right.
And they have to figure out how to stabilize the logistics of it.
A logistics triage nurse is, it's a perfect way to look at it. Because if that dispatcher is just acting like a data entry clerk, I shouldn't say just acting, but if they are rushing the caller, sighing, or just rapidly demanding like address, time, date.
Well, that would be awful.
Right. They are taking an already highly pressurized situation and cranking up the heat. They are actively degrading the patient's experience before the service even begins.
And this connects directly to clinical healthcare metrics, doesn't it? I mean, the Agency for Healthcare Research and Quality, the AHRQ, they conduct these massive evaluations called CHPS surveys.
Right, the consumer assessment of healthcare providers and systems.
Yes, those. Essentially, they measure the patient's experience of care. Do they feel listened to? Was communication clear? Were services easy to access?
Exactly. Now, strictly speaking, an NEMT ride is not a medical visit. The driver isn't, taking your blood pressure or administering medication.
Yeah, they're just driving.
But the psychological principles governing the patient's experience absolutely apply to the ride getting them there. People remember how they were treated.
Of course they do.
If the process of simply arranging the ride to the cardiologist is a chaotic, disrespectful nightmare, that patient arrives at the clinic already flooded with cortisol.
So their heart rate is up, their anxiety is peaking all before they even see the doctor.
Exactly.
Which is fascinating because it implies that a calm, competent voice on the phone can actually act as an anxiety reduction tool for the medical treatment itself.
It really can.
If the dispatcher asks respectful questions and provides clear instructions, they are effectively lowering the patient's defensive barriers.
They are providing reassurance in a chaotic system. I mean, a good customer service experience in NEMT communicates a very specific subconscious message.
What's that?
It says, you are not just a ticket number. Your physical reality and your situation matter to us. And for the specific demographics that utilize NEMT, that message is absolutely critical.
Yeah, let's talk about those demographics, actually, because that context explains why this level of care is so necessary.
Yeah.
We aren't talking about a demographic of, like, able-bodied 30-somethings going to a routine dental cleaning.
No, not at all. We are primarily talking about older adults who are navigating the loss of their physical independence.
Which is an incredibly vulnerable transition.
It's massive. We are talking about individuals with permanent disabilities who spend their entire lives navigating a physical world and often an administrative world, honestly, that was not designed to accommodate them.
Yeah, that's so true.
We are also talking about patients recovering from major traumatic surgeries or individuals dealing with chronic debilitating illnesses.
Dialysis patients are probably the most striking example of this, right? If you're a listener who doesn't have experience with dialysis, this is a procedure where a machine filters your blood because your kidneys can no longer do it.
Right.
And you don't just go once. You typically have to go to a clinic 3 times a week, every single week. The treatment takes hours and it leaves the body completely exhausted.
It drains you completely. Often your blood pressure drops, you feel incredibly weak, you might be nauseous.
Wow.
So if you are that patient, the medical transport vehicle is a massive recurring fixture in your life. You spend hours every week in these vans.
I can't even imagine. So if the dispatcher coordinating your life treats you like a widget on an assembly line, like rushing you off the phone and getting your details wrong, it fundamentally degrades your dignity.
Exactly. It's dehumanizing. But if the dispatcher takes the time to know your needs, that is a literal form of care.
Yeah. But of course, empathy alone doesn't get a patient to the hospital. You can be the kindest person on earth over the phone, but if you send the van to the wrong zip code, you've failed.
That is the harsh reality. Empathy has to be paired with meticulous execution.
Which brings me to this fascinating distinction in the material regarding the architecture of a ride. It requires a really rigorous data foundation.
It does. And the data gathering process in NEMT is fundamentally different from standard rideshare.
Right. Because if I pull out my phone and open Uber or Lyft, the algorithm basically asks me one question: where to?
Exactly. Just where to.
It assumes I am fully mobile, I know exactly when I want to leave, and I can just walk out to the curb whenever the car arrives.
Right. But in NEMT, where to is almost secondary. The primary question the dispatcher is trying to answer is, what exactly does this specific human being need in order to travel safely and arrive on time?
Because the baseline assumption is the exact opposite of rideshare.
Yes. The baseline assumption in NEMT is that the passenger has logistical, physical, or cognitive barriers to standard travel. So the dispatcher has to construct an architectural blueprint for the ride.
I would push back on this a little bit, though, or at least play devil's advocate for a second.
Go for it.
Because when you look at the basic fields, a dispatcher needs to fill out pickup address, drop-off address, appointment time, phone number on the surface. That looks like basic data entry.
Sure, it does look like that.
So why does this require a highly skilled human being? Couldn't we just have families fill out a web form and automate the whole thing?
It's a really great question, and it gets to the heart of why automation often fails in healthcare logistics. A web form can collect data, sure, but a human dispatcher analyzes and stress tests that data.
Stress tests it. How so?
Let's break down the difference between an appointment time and a pickup time to see why.
Okay, let's do that. So say I have an MRI scheduled at 2 p.m. In a web form, I just type 2 p.m.
Exactly. And a basic algorithm might say, okay, the drive takes 20 minutes, so we will pick you up at 1:40 p.m.
Right, that's what a GPS app would do.
But an experienced NEMT dispatcher looks at that 2 p.m. appointment and starts factoring in the human friction. They know that if your MRI is at 2 p.m., you cannot be walking through the front revolving doors of a 500-bed hospital complex at 1.59.
Oh, because I still have to actually get to the MRI machine.
Right, you have to navigate the campus. The dispatcher knows that for this specific hospital, the van has to pull into a specific transit lane.
Gotcha.
Then, the passenger, who might be moving slowly with a walker, has to get from the curb to the lobby.
Which could take 5 or 10 minutes right there.
Easily. They have to wait for an elevator, navigate to the radiology department on the 4th floor, check in at the reception desk, give their insurance card provide their insurance card, fill out a medical history form, and sit in the waiting room.
So the transit time isn't just the driving time. It's the driving time plus the facility navigation time, plus the patient's specific mobility speed.
Precisely. The dispatcher has to reverse engineer all of those variables to calculate a safe, realistic pickup time.
That's intense.
It is. If the patient needs 30 minutes just to navigate the building and do paperwork, the dispatcher knows they need to arrive by 1:30 p.m.
Okay, that makes sense.
And if the drive is 20 minutes and the patient takes 15 minutes to safely board the vehicle at their house, that 2 p.m. appointment means the driver actually needs to arrive at the house at 12:55 p.m.
Wow. From 1.40 all the way back to 12.55, a web form doesn't calculate human friction. A dispatcher does.
Exactly.
That makes total sense.
Yeah.
They are actively managing the timeline to protect the appointment. And what about the other end of the trip, like the return rides? Because if I think about my own medical appointments, I never actually know when I'm going to be done.
Almost never. Medical scheduling is notoriously unpredictable.
Yeah, you might sit in the waiting room for 45 minutes before they even call your name.
Right, or the doctor might find something and order an impromptu blood draw that adds another hour to your visit.
So you can't just schedule a van to pick them up at, say, 3 p.m.
No, because if the van arrives at 3 p.m. and the patient is still in an exam room, the driver can't just wait outside for an hour. They have other patients to pick up.
So what does the dispatcher do?
So the dispatcher has to set up what's called a will call return, but setting it up isn't enough. The dispatcher has to establish the exact communication protocol for that will call.
Meaning they have to figure out how they're going to know when the patient is actually ready?
Exactly. The dispatcher has to ask, does the patient have a cell phone to call us when they are standing in the lobby?
And what if they don't?
Well, if the patient has dementia, for instance, and doesn't carry a phone, the dispatcher has to coordinate with the clinic. They have to ask, will the charge nurse call us when the patient is ready?
That's a huge detail to catch.
It is, because if you don't build that communication bridge on the front end, you end up with a vulnerable person stranded in a waiting area at 5 p.m. when the clinic is trying to lock the doors.
That sounds like a nightmare.
Yeah.
And then you have the physical navigation of the addresses themselves. The material points out that it's rarely just like 123 Main Street.
Right, because 123 Main Street could be a massive apartment complex with 10 different buildings. The dispatcher has to dig deeper. Which building? Is there a gate code? Is the buzzer broken? Are there stairs leading up to the porch? Is the elevator in the building reliable?
I imagine if they miss just one of those details, say, they don't get the gate code, the driver shows up, sits at the gate for 5 minutes, assumes it's a no-show, and leaves to stay on schedule.
Yes. And suddenly, the patient misses their appointment. Which brings us to the actual stakes of all this detail gathering. We have to view this through the lens of federal healthcare policy.
Okay, let's talk about the policy side.
So the Centers for Medicare and Medicaid Services, CMS, they dictate strict rules for NEMT. Medicaid actually has an assurance of transportation requirement.
An assurance of transportation. What does that mean in practical terms?
It means that state Medicaid programs are federally mandated to ensure that eligible beneficiaries have necessary transportation to and from covered medical services.
So it's not optional.
No, it is a recognized healthcare benefit. Because the government understands that paying for a doctor's visit is useless if the patient physically cannot get to the building.
That's a great point. So if a dispatcher rushes a call, makes a typo on an apartment number, and the ride fails, they aren't just inconveniencing someone. They are actively causing a failure in a federally mandated healthcare system.
That's the reality. Missed logistical details lead directly to missed entrances. Missed entrances lead to delayed pickups. And in the medical world, delays equal missed appointments.
And when a patient misses an appointment, it's not just a scheduling hiccup.
No, their health often deteriorates, which leads to emergency room visits, which massively drives up costs for the entire healthcare system. The dispatcher's logistical blueprint is the foundation of preventative care.
Okay, you've completely sold me. It is absolutely not just data entry. It's so much more.
Definitely.
But let's move to the next layer of this puzzle, because getting the time and the address right is only half the battle, right? Once they have that blueprint, they face what seems to be the highest liability aspect of the job.
Yeah, matching the physical realities of the human being to the correct physical vehicle.
Exactly. Verifying mobility needs. This is where safety is won or lost. Now, there's a very firm boundary established right away when discussing this in the material. Dispatchers are logistics professionals. They are not doctors.
Right. They are not nurses or case managers. They do not diagnose conditions.
That makes sense.
That boundary protects everyone. A dispatcher should never offer medical advice, they shouldn't interpret a diagnosis, and they definitely shouldn't be making clinical judgments about a patient's treatment.
But the paradox here is that they still have to ask incredibly probing, specific questions about a person's physical body and their capabilities, right?
Yes, they do. They aren't asking for a diagnosis, but they absolutely must ask for functional, transportation-related capabilities. They aren't asking why you can't walk, but they must ask if you can walk.
That's a really clear distinction. Let's dissect some of these specific questions because it's fascinating how nuanced they have to get. If a caller says, "My mom needs a ride, she uses a wheelchair," the dispatcher can't just check a box that says wheelchair and move on.
Not at all, because wheelchair is way too broad a category. The immediate follow-up question has to be, is it a manual wheelchair or a power wheelchair?
If I'm a layman trying to schedule this, I might think, what difference does it make? A chair with wheels is a chair with wheels.
The difference is about 300 pounds and massive liability.
Oh, wow. Really?
Yes, a standard manual wheelchair is relatively light. It can be folded up and put in the trunk of a sedan if the patient transfers, or it can be easily pushed up a ramp into a van.
Okay, that makes sense.
But a power wheelchair or a motorized scooter contains massive batteries. They can weigh anywhere from 200 to 450 pounds, even when completely empty.
That is incredibly heavy, so you can't just lift that into a truck.
No human is lifting that.
Yeah.
And more importantly, a power chair has a completely different center of gravity. It requires highly specific heavy-duty securement straps called tie-downs that are actually built into the floor of the vehicle.
Oh, to keep it from moving during the drive.
Exactly. If a dispatcher just hears wheelchair and sends a standard minivan with a lightweight ramp, the ramp might literally buckle under the weight of the power chair.
That sounds incredibly dangerous.
It is. Or the driver won't have the heavy-duty tie-downs necessary to keep that 400-pound chair from becoming a lethal projectile if the van has to brake suddenly.
That is a terrifying image. And it all hinges on the dispatcher asking one extra clarifying question.
Right.
Now, what about the concept of transferring? You mentioned earlier that some people with wheelchairs ride in sedans.
Right. So the dispatcher must ask, can the passenger transfer into a seat independently or with the help of their escort?
Why does the dispatcher need to know if they can do it independently? Can't the driver just help them?
This is a huge misconception in the industry. NEMT drivers are generally trained in what is called door-to-door or curb-to-curb service. They can offer a steadying arm, they operate the hydraulic lifts, and they strap the wheelchairs down. But for liability and safety reasons, NEMT drivers are strictly prohibited from physically lifting and bearing the full weight of a patient to move them from a wheelchair into a car seat.
Because if the driver slips or if the patient loses their balance?
The patient is dropped, bones are broken, and the driver blows out their back. It's a disaster. So if the patient uses a wheelchair but wants to ride in the front seat of a sedan, they must be able to stand, pivot, and sit down on their own, or have a family member there to physically lift them.
And if the dispatcher doesn't verify this?
A driver shows up in a four-door sedan expecting an independent transfer. Instead, they find a patient paralyzed from the waist down who fully expects the driver to physically carry them into the car.
Oh, man. The ride is over before it even begins.
Exactly. The driver has to refuse for safety reasons. The patient feels abandoned and they miss their appointment.
I'll give you a functional metaphor that popped into my head. Imagine you have a broken down motorcycle. You call a towing company and just say, "I need a tow." If they don't ask what kind of vehicle it is, they might send a massive flatbed truck designed for an SUV.
That's a great metaphor.
Right, like, sure, it's a tow truck, but the mechanics of the equipment are completely wrong for the cargo, and trying to use it could damage the motorcycle further.
Exactly. In NEMT, sending the wrong vehicle mechanics isn't just inefficient, it's physically dangerous.
That brings up another vital question the dispatcher has to ask, which is, can the passenger sit upright for the duration of the ride?
This one often comes up during hospital discharges. A patient might have just had spinal surgery or severe abdominal surgery, or they might just suffer from profound weakness.
Okay.
If they cannot maintain a seated, upright position at a 90-degree angle for 20 or 30 minutes.
Then they can't go in a standard van.
Yeah.
And they can't go in a wheelchair van either, because both require sitting upright.
Right. At that point, they require stretcher transportation, which is an entirely different tier of service.
What does that entail?
It involves an ambulance-style cot, a completely different vehicle configuration, and usually requires 2 trained personnel to safely load and unload the stretcher.
So if a hospital discharge planner calls and the dispatcher just assumes the patient can sit in a wheelchair, they might send a standard van.
Yep. The driver arrives at the hospital room, sees a patient who is completely bedbound and cannot sit up, and the driver immediately has to cancel the trip.
And now the hospital has a patient occupying a bed that they thought was going to be empty.
Exactly. The emergency room might have a patient waiting in the hallway for that exact bed. The entire flow of the hospital is bottlenecked because the dispatcher failed to ask about sitting upright.
It really emphasizes how every single detail they collect acts as a failsafe.
It really does. And there's one more subtle question they need to ask, which is simply about time.
Like extra time.
Yes. Will the passenger need extra time to board?
Why is that so important?
If you have severe arthritis or a neurological condition like Parkinson's, simply walking from your front door down the driveway to the van might literally take 10 minutes.
Wow.
If the dispatcher schedules that trip using the standard 5-minute loading window, the driver falls behind schedule the moment they arrive.
And when a driver's behind schedule, they get stressed, which makes the passenger feel rushed. And the last thing an 85-year-old with balance issues needs is to feel rushed while navigating a set of front porch stairs.
Exactly. It creates a massive fall risk. So safety in this industry hinges entirely on the dispatcher's rigorous verification of these mobility details.
Okay, so let's say the dispatcher has done everything right. They have the logistical blueprint mapped out, and they have perfectly matched the passenger's physical mobility to the correct vehicle. Now they step into what is essentially a translation role.
They do. They become the central communication nexus for the entire operation.
Right. They hold all the information, and now they have to distribute it to 3 different parties.
Yeah.
The drivers, the caregivers, and the healthcare facilities. Let's start with the drivers, because this brings up an immediate red flag for me regarding federal privacy laws.
IPA.
Yes, IPA. The Health Insurance Portability and Accountability Act. This law strictly protects a patient's medical information. A dispatcher can't just blast out over a radio or an app like, hey, Mr. Smith has late-stage pancreatic cancer and just had a bowel resection. Go pick him up.
Absolutely not. That is a massive HIPAA violation and a gross breach of privacy.
I would assume so.
The driver does not need to know a patient's diagnosis. The driver does not need to know what kind of doctor they are seeing or what their prognosis is. But the dispatcher still has to prepare that driver for the reality of the passenger they are picking up. This is what we call the privacy tightrope.
So how do they translate the complex medical reality they just learned into instructions the driver can actually use without breaking the law?
The key is filtering. The dispatcher must translate medical facts into transportation-relevant instructions. Let's use your example of someone recovering from major abdominal surgery.
Okay.
The dispatcher knows the surgery happened, and they know the patient is in severe pain.
Right. But they can't tell the driver about the surgery.
So the dispatcher writes in the trip notes, passenger moves very slowly and requires extra time for loading. Passenger is highly sensitive to movement. Please avoid sudden braking, take turns smoothly, and drive carefully over speed bumps.
That is brilliant. You are giving the driver the exact behavioral roadmap they need to provide safe, empathetic service, but you haven't disclosed a single medical secret.
Exactly. The driver knows what to do without needing to know why they're doing it. Good dispatching supports good driving by removing the guesswork.
That makes a lot of sense.
It also means giving the driver environmental notes, like the pickup is at the side entrance by the cafeteria, not the main lobby, or you must check in with security at the front gate.
Or, beware the dog in the front yard.
Yes. Please call the daughter upon arrival. Do not ring the doorbell because it agitates the family dog. That level of detail prevents the driver from making an innocent mistake that derails the entire morning.
And you mentioned the daughter there, which perfectly transitions us to the second group the dispatcher has to communicate with, the caregivers.
Yes.
I feel like this group is so often overlooked when we talk about healthcare logistics.
Family caregivers are the invisible backbone of the healthcare system. Spouses, adult children, sometimes even neighbors, they're the ones actually making these phone calls.
Yeah, if you've ever had to manage care for an aging parent, you know exactly how heavy that burden is. You are trying to maintain your own career, pay your own mortgage, raise your own kids, and simultaneously act as a part-time medical coordinator for someone whose health is declining.
The cognitive load is staggering.
It really is. So when that adult daughter calls the NEMT provider, she isn't just booking a ride. She's looking for reassurance that this one piece of her overwhelming puzzle is going to be handled competently.
The dispatcher's duty is to recognize that stress and provide certainty.
How do they do that practically? Just by being nice?
No, it's more than that. It's by proactively confirming the details that alleviate worry. The dispatcher should say something like, okay, we have the driver arriving at 1 p.m. The driver will call your cell phone when they pull up. Are you going to ride along with your father, or will you meet him at the clinic?
Oh, they establish the chain of custody, essentially.
Exactly. They set expectations. If the driver hits traffic, here is the protocol. Here is the number to call if his appointment runs late.
So it's not just taking the order, it's walking them through the whole process.
The philosophy here is that NEMT does not replace family support. It empowers it. By communicating clearly, the dispatcher allows that daughter to hang up the phone, take a deep breath, and go back to her job knowing there's a solid plan in place and she won't be kept in the dark.
It's like structural empathy. Now, the final piece of this communication nexus is coordinating with the healthcare facilities themselves, the hospitals, the rehab centers, the clinics. I have to imagine hospitals are incredibly strict about how this works.
Oh, they are. Hospitals are massive, highly pressurized logistical machines. They rely entirely on predictable flow. If a hospital discharge planner clears a patient to go home, they need that bed for a new admission from the ER.
Right. So if the transport is disorganized, the patient just sits in a wheelchair in the hallway with their belongings in a plastic bag for 4 hours.
Which happens every single day across the country, unfortunately. It is miserable for the patient and a logistical nightmare for the hospital.
So what's the dispatcher's role there?
Dispatchers must communicate clearly with the facility to ensure readiness. They have to ask, is the patient actually ready? Are the discharge papers signed? And has the pharmacy sent up the take-home medications?
Because if the dispatcher sends the van, but the pharmacy is backed up and the meds won't be ready for an hour.
Then the driver arrives, finds out the patient can't leave, and now the driver is stuck. They can't wait an hour. They have other trips.
Sorry.
So the driver leaves, and the facility has to request a whole new ride later, causing massive delays. Furthermore, the dispatcher needs to understand the facility's specific policies.
Like where the driver's physically allowed to go.
Exactly. Some rehab centers require the driver to park, enter the building, take the elevator to the 3rd floor, and physically sign the patient out at the nurse's station.
Okay, that's pretty involved.
But other hospitals have strict liability rules forbidding drivers from leaving their vehicles. The hospital transport team must wheel the patient all the way out to the curb.
Wow, totally opposite rules. If the dispatcher doesn't figure out which rule applies, you have a driver sitting in the van at the curb, angry that the patient isn't coming out, and a nurse on the 3rd floor furious that the driver hasn't come up to get them.
And the patient is caught right in the crossfire. There is a golden rule in healthcare transportation. Assumptions create delays. Clear communication prevents them. The dispatcher's job is to eradicate every assumption from the plan.
Okay, so let's pause and admire the work they've done. I mean, they have built an airtight architectural blueprint. They have perfectly matched the vehicle to the mobility needs. They have successfully filtered information for the driver, reassured the caregiver, and coordinated with the hospital's exact discharge protocols. It is a masterpiece of logistics.
On paper, it is a masterpiece on paper.
Right, because the real world doesn't care about your paper masterpiece. The real world is profoundly, endlessly messy. Which brings us to the phase of the job that probably requires the most adrenaline. chaos management.
Chaos management, yes.
Okay.
No matter how perfect the plan is, reality is going to intervene. The variables in transportation are infinite.
You're dealing with weather, right? Like a sudden torrential downpour or a snowstorm that cuts highway speeds in half. You're dealing with traffic accidents that turn a 20-minute drive into a 90-minute gridlock.
Exactly. Or you have medical variables, like the specialist doctor getting pulled into emergency surgery so the entire afternoon clinic schedule is blown up.
Or human variables.
Right. The patient might be having a terrible pain day and they just need an extra 20 minutes to physically get their coat on and get out the door.
So when these things happen, the dispatcher's role fundamentally shifts.
Completely. They are no longer in the scheduling phase. They move into triage and communication management.
So paint a picture for me. It's 3 p.m. on a Tuesday. A massive accident just shut down the interstate, and the board is lighting up red. What is the dispatcher actually doing?
Well, the worst instinct in that moment is silence.
Silence.
Yeah. Some companies, when things go wrong, just hunker down and hope the customer doesn't complain. But silence is the enemy of trust. If a driver is stuck in that interstate gridlock and is going to be 30 minutes late, the dispatcher must proactively start making phone calls.
They don't wait for the angry phone call. They initiate the update.
Yes. They call the elderly passenger who is standing on their porch, worrying they've been forgotten. They say, "Mr. Johnson, I want to let you know your driver is stuck in traffic due to an accident on I-95. He is safe, but he is running about 30 minutes behind."
But Mr. Johnson is going to panic because he thinks he's going to miss his doctor's appointment.
Which is why the dispatcher follows up immediately with, "And please don't worry, I have already called your cardiologist's office to inform them of the delay. They know you are on your way, and they are going to hold your appointment slot."
Oh, wow. Taking the initiative to run interference with the doctor's office on behalf of the patient. That completely diffuses the panic.
It does. The patient knows someone is actively looking out for them. It shifts the experience from, "I'm abandoned in a broken system," to, "I have an advocate managing the situation."
It's a vital customer service skill. However, when we talk about managing chaos, we have to address a critical safety boundary mentioned in the material.
Right. The distinction between an urgent situation and an actual medical emergency.
This seems like a really fine line sometimes.
It is a matter of life and death, and dispatchers must be rigorously trained on it. NEMT, non-emergency medical transportation, is strictly for medically stable passengers.
So imagine a scenario where an elderly woman calls. She is panicked because her husband woke up with crushing chest pain. He's sweating, he's struggling to breathe, and she wants to book a wheelchair van immediately to get him to the emergency room.
The dispatcher must immediately halt the booking process. They cannot say, "Okay, a van will be there in 20 minutes. They must instruct the caller to hang up and call 911 immediately, or the dispatcher should offer to patch them through or call 911 on their behalf.
Because an NEMT vehicle is not an ambulance.
It is not an ambulance.
Yeah.
NEMT vehicles do not have sirens to run red lights and bypass traffic. They do not have oxygen tanks, defibrillators, or life support equipment.
And the drivers aren't paramedics either.
Exactly. While trained in CPR and first aid, they are not paramedics. If you put a man having an active myocardial infarction, a heart attack, into the back of a standard wheelchair van, and that van hits traffic, that man could die in the back seat with no medical intervention available.
That's a sobering thought. The dispatcher acts as the first line of defense to ensure the patient gets the appropriate level of clinical care. They have to know their scope of practice.
They absolutely do.
Now, while they are juggling all of this chaos, navigating delays, and filtering emergencies, they also have strict compliance standards they must uphold regarding how they communicate, right?
Yes. The Americans with Disabilities Act, the ADA, plays a huge role here, specifically regarding effective communication.
When we think of the ADA, we usually think of wheelchair ramps, wider doorways, and physical accessibility.
Yeah.
How does it apply to a dispatcher sitting in a call center?
The ADA mandates that a business must communicate as effectively with people who have disabilities as they do with people without disabilities. For NEMT dispatchers, this is a daily, practical reality.
Because they're talking to this demographic all day.
Right. They are routinely speaking with passengers who have vision limitations, profound hearing loss, or cognitive and communication challenges.
How do you adapt to that over a phone call when you have, like, 10 other lines ringing?
It requires immense discipline and a complete abandonment of ego. Let's take the example of expressive aphasia, which is a condition often following a stroke.
Okay.
A person with expressive aphasia knows exactly what they want to say. Their intellect is entirely intact, but the pathway from their brain to their vocal cords is damaged, making it very difficult and slow to form words.
So they might struggle for 10 or 15 seconds just to articulate their street name.
Exactly. If a dispatcher is stressed about their call volume and starts tapping their pen, sighing, or worse, aggressively guessing and finishing the person's sentences in a frustrated tone, that is incredibly demeaning. It strips the caller of their dignity.
It essentially punishes them for their disability.
It does. A professional dispatcher creates a safe acoustic space. They allow to silence, they don't rush.
That takes a lot of patience.
It really does. If someone has a cognitive decline or hearing loss, the dispatcher must be willing to speak more slowly and clearly without raising their pitch into that condescending baby talk voice people sometimes unconsciously use.
Oh, I hate when people do that.
It's awful. They must be willing to patiently repeat the same instruction 3 times until comprehension is confirmed.
It really redefines customer service. It's not just having a cheerful, bubbly tone. It is providing structural, disciplined respect to people who are often marginalized by our fast-paced society.
And every single piece of that interaction, every delay they manage, every accommodation they make, leads into the next crucial phase of the job.
Which is,
Documentation.
okay, documentation.
Yeah.
I know that word usually makes people's eyes glaze over. It sounds like the ultimate corporate busy work, logging timestamps, filling out drop-down menus, writing trip notes.
I know it does, but you can't run a healthcare logistics company without it.
You absolutely cannot. In the world of healthcare compliance, there is a famous saying, if it wasn't documented, it didn't happen.
It's so true. Human memory is incredibly fallible, especially when a dispatcher is handling 100 trips a day.
So why is logging every single detail so crucial for NEMT?
Because NEMT is heavily funded by Medicaid, and the Centers for Medicare and Medicaid Services demand strict accountability for taxpayer dollars. They require proof of efficiency, economy, and quality of care.
But beyond the financial audits, documentation is the ultimate protection for the patient, the driver, and the company when things go wrong.
Walk me through a scenario where documentation actually saves the day. Let's say we have a disputed trip.
Oh, you want me to give a scenario? Let's use a classic one from the notes.
Yeah.
An angry social worker calls from a dialysis clinic on a Friday afternoon. She claims that the NEMT driver never showed up to take her patient home, the patient's been sitting in the lobby for 3 hours, and the company is completely incompetent.
Yikes. Okay. Without documentation, you just have a he said, she said nightmare. The driver says he was there. The clinic says he wasn't. The dispatcher has no idea who is telling the truth.
Exactly. But if the dispatcher has enforced strict documentation protocols, they can open the trip log and read the timeline. They can say, let me look into this. Okay, my records show our driver, David, arrived at the clinic at 1:15 p.m. At 1:20 p.m., he called the patient's cell phone and left a voicemail.
Wow, okay.
At 1:25 p.m., David physically walked into the lobby and spoke with the receptionist, Brenda. Brenda informed David that the patient's son had arrived early and decided to drive the patient home himself. David was officially released from the trip at 1:30 p.m.
That is incredible. That completely diffuses the anger and changes the entire narrative. The driver didn't abandon the patient. The family simply forgot to cancel the ride with the transport company and didn't tell the social worker.
Right. The documentation protects the driver from being unfairly disciplined, it protects the company's contract with the facility, and it highlights a breakdown in communication at the clinic.
It's bulletproof.
Furthermore, aggregated documentation is how leadership improves the entire system.
What do you mean by aggregated documentation?
Well, if leadership looks at the data from the past month and sees that out of 50 trips to a specific orthopedic clinic, 40 of them involve the driver waiting an extra 30 minutes because the clinic always runs behind.
Oh, I see. Then the dispatchers can stop sending drivers there at the exact scheduled time. They can adjust the algorithm to automatically build in a 30-minute buffer for that specific clinic.
Precisely. Documentation isn't busy work. It is the raw data required for continuous systemic improvement.
That makes total sense, which provides the perfect transition to the final major theme we need to explore today, the human element versus the algorithm.
Right. Because if we are talking about data, algorithms, and efficiency, it forces a very modern question. It's 2026. We have advanced AI routing, we have automated SMS systems, we have sophisticated digital CRM platforms.
You have all the tech.
Why does the human dispatcher still matter? Couldn't we just automate this entire industry and eliminate the human error?
It is the defining question of modern logistics. And to be clear, modern NEMT companies heavily utilize all of that technology. They use complex scheduling algorithms to optimize routes and reduce empty miles.
Sure.
They use real-time GPS tracking so they know exactly where every vehicle is to the meter. They use automated text messages to remind patients of their rides.
Those tools are incredibly powerful for efficiency.
They are indispensable. They provide transparency and scalability. But here is the friction point, and it's summarized perfectly by the philosophy used at SwiftAid Transport. A scheduling system cannot replace compassion. GPS cannot replace patience.
That hits hard.
Yeah.
Because technology is fundamentally binary.
Yeah.
An algorithm operates on yes or no, optimal route versus suboptimal route. It calculates the fastest line between two coordinates.
But human healthcare is not binary. It is profoundly gray. It is nuanced and emotional. An automated text message that says, "Your vehicle is arriving in 3 minutes," is useful data. But an algorithm cannot listen to the tone of voice of a terrified elderly man whose wheelchair suddenly won't fold and talk him through the problem.
Right.
An algorithm doesn't know that a passenger is grieving because they just found out their cancer treatment isn't working.
So the technology should serve the people, not the other way around. Digital tools should empower the dispatcher to make faster, better decisions so they have more time to be human on the phone.
Exactly. The goal of integrating technology into NEMT should never be to make the service feel cold, robotic, or transactional. The dispatcher is the first voice of the company. If the algorithm is highly efficient, but the dispatcher who answers the phone is dismissive and impatient, the entire company feels dismissive to the patient.
SwiftAid has this guiding standard, people over profit. In the context of dispatching, I imagine that means making the active choice to prioritize the passenger's dignity even when it's slightly less efficient.
It means recognizing that a caller's worry or their complex mobility need matters more than simply closing the support ticket in under 60 seconds to hit a call center quota.
This philosophy actually provides a fantastic tool for you, the listener, because at some point in your life, you are likely going to have to arrange transportation for an aging parent, a spouse recovering from surgery, or perhaps even yourself.
Absolutely. You shouldn't just Google medical transport, pick the first result, and hope for the best.
You are entrusting a vulnerable family member to this company. You have every right to interview them. The way their dispatch team handles your questions will tell you everything you need to know about their corporate culture.
So what should a listener actually ask when they call an NEMT provider?
Start with chaos management. Ask them, how do you handle delays? If the driver is stuck in traffic, what is your protocol? Will someone proactively call me? Or will my mother just be left waiting on the porch?
And that's a great test. If they say, "Oh, our app updates," that might not be good enough if your mother doesn't use a smartphone. What else?
Ask about the communication chain. How do your drivers receive pickup notes? If I tell you my father is hard of hearing and the driver needs to knock loudly, how do you ensure the driver actually sees that note?
And the mobility questions. This is the ultimate test. You could say, "My mother uses a wheelchair,"
Yeah.
and then just stop.
Yes. See what they do next. If they just say, okay, noted, a wheelchair van will be there, you should hang up. Because you know they aren't asking the vital safety questions about whether it's a manual or power chair or whether she can transfer. They are failing the safety verification test.
You can also ask about the return trips. What happens if the doctor's appointment runs an hour late? Does the driver leave? How do we coordinate the ride back?
And finally, ask about accountability. Do you document trip details and timestamps? If something goes wrong, who do I call to get a record of what happened? If the dispatcher stumbles over these questions, or if they act annoyed that you are taking up their time, you have your answer. Move on to another provider.
It really puts the power back in the hands of the families to demand a higher standard of care. This has been such an illuminating journey.
It really has. If we synthesize everything we've covered today, we started by looking at a white van pulling up to a curb. But what we've discovered is that the dispatcher is the unseen, vital engine of the entire operation.
They are the architects. They gather the intricate logistical details to calculate safe timelines. They provide emotional support and certainty to overwhelmed caregivers. They rigorously match physical mobility needs to the correct vehicle mechanics to prevent disaster.
They act as the communication nexus, filtering medical realities into practical driving instructions. They manage the inevitable chaos of the real world with proactive communication, and they document everything to ensure systemic accountability.
So that by the time you actually see that van pull up to the curb, the heavy lifting has already been done. The ride is already a success before the passenger even opens the door because it was built on a foundation of meticulous, empathetic dispatching.
It makes you look at that call center headset in a completely different light.
It does, and I want to leave you with a final thought on this, building on the idea that transportation is a social determinant of health.
Let's hear it.
We've established the stakes today. If a dispatcher makes a careless mistake, if they rush a caller and miss an apartment number, or send the wrong vehicle, a patient might miss a vital dialysis treatment. Their health will actively decline. Conversely, if a dispatcher communicates brilliantly, verifying every detail and managing delays with compassion, a highly vulnerable person accesses life-saving treatment without experiencing additional trauma.
Wow.
If their clear communication and logistical planning directly determine whether a marginalized patient can actually access the healthcare system well, perhaps we need to change our vocabulary.
I think you're right.
Perhaps we shouldn't view these men and women merely as customer service representatives. Perhaps we should view them as frontline public health workers, actively dismantling healthcare inequalities one phone call at a time.
Frontline public health workers. I think that is the perfect lens for this. It completely elevates the profession and gives immense, deserved dignity to the people doing this complex work behind the scenes. Thank you for joining us on this deep dive. I guarantee that the next time you see a medical transport van on the road, you are going to view the logistics of care through a completely new, much more human perspective.